All right, this is the second part of the week 6 lecture, and for this one we're going to be looking at auditory perception and auditory training, but looking at the special considerations for children with hearing loss. So it's obviously going to be a little bit different when it's an adult who developed hearing loss postlingually, so after they'd already developed language, versus a child who maybe has developed hearing loss prelingually or perilingually, so either before developing language or in the process of developing language. And we're going to approach it a little bit different. With language and communication, we detect a child has hearing loss, the families have the right to choose the language or communication modality for their child. And it's important that we present the different options in a non-biased manner so that the family can choose what they think is going to be best. Some of the different modalities are listening and spoken language, manual and visual systems, and systems combining both visual and auditory information. So for listening and spoken language, it really focuses on the use of residual hearing and consistent use of their amplification devices, whether it be hearing aids, cochlear implants, bone-anchored hearing aids, FM systems. And then the manual visual system is looking at using American Sign Language as their primary means of communication. In this system, amplification can still be used, but it's not critical with this approach. And then more recently, there's been the development of kind of a bilingual, bicultural approach with the manual visual system. And in that case, American Sign Language is their primary or first language, but then English is taught as a second language in terms of written communication, literacy. And so they've developed this approach to still have them learn their primary language, American Sign Language, but then also learning English written communication. And then there are systems that combine both visual and auditory information. This can either be a total communication, which uses manually coded English or finger spelling, speech reading, natural gestures, residual hearing, and speech. So like the term implies, total communication, it's kind of using it all. And then cued speech, which is different from sign language, but it does use a set of hand shapes and movements that help to visually differentiate sounds that may look similar on the lips. So there's a lot of speech reading, and certain sounds are harder to distinguish, and so they'll have a specific hand symbol or gesture to help distinguish between those sounds that look very similar. So we present these different options to individuals or parents of a child with hearing loss, and they get to choose what they think is going to be best. Sometimes it can be helpful to have them talk with other parents of children with hearing loss, maybe parents that have chosen some of the different, so maybe a parent that has chosen listening and spoken language, another parent who chose American Sign Language, so they can kind of see some differences. Remember, we learned in previous weeks that most children that are born with hearing loss are still have parents that are normal hearing, or at least don't necessarily identify with like the deaf community. And so it's typically more common to see that parents without hearing loss are going to maybe lean more towards listening and spoken language or a total communications type of modality. but it's important that they be aware of the different options. There are some factors that will affect their speech and language development, and a lot of that deals with and has helped to drive the need for early identification and early intervention. And you can see here kind of our standard of 1, 3, and 6. So by 1 month, all infants should have had their hearing screened. By 3 months, they should have had follow-ups if they didn't pass the original screening, and hopefully have a diagnosis. And then by 6 months, they should have received medical or educational or audiologic intervention if they were diagnosed with a hearing loss. And what they have kind of based this 1, 3, and 6 protocol on is that by 6 months of age, children with normal hearing have learned to discriminate the sounds of their native language. And so we're hoping that by early detection and early intervention, we're going to help these children as they try to catch up to their peers. And research has shown that children with hearing loss who have received management by 6 months of age often develop age-appropriate speech by 5 years of age. And that's really encouraging. So it's important that appropriate amplification be chosen and fit as soon as possible once the hearing loss has been identified. And also that the child is wearing it consistently. And this can be really hard on a 6-month-old baby. It takes a lot of training with the parents. And remember, we talked about how they may be going through the grief process, and so it's definitely an involved process. But the amplification could be hearing aids, it could be a cochlear implant, it could be the bone anchored hearing aid, could include an FM system, and so it could be any of these things or a combination. And it's important that we get these on as soon as possible and that they have consistent use. We talked a little bit about having age-appropriate speech by 5 years of age, but we also see that if they aren't getting early intervention services, then the effects of the speech perception due to the hearing loss can also carry over into delays in literacy or written communication, and so they may score lower in terms of literacy and reading than their same-aged peers if they don't receive early intervention services. When working with children with hearing loss and you're performing speech assessments, it's important to know that speech characteristics in children with hearing loss. So knowing what's going to be different in the speech characteristics of these children versus their normal hearing peers. And the textbook covers some of the common speech or articulation errors that you may find in children with different types of hearing loss, so I'd recommend that you review those. The assessment can include traditional articulation and phonology tests such as the Goldman-Fristow. I'm sure you guys have all heard of that one. And these tests are still appropriate because the goal is to eventually achieve age-appropriate speech. And so we would probably expect them to score lower than their normative data or their peers, but hopefully it can help us track the progress as they improve. With the therapy or the auditory training, it's important to understand that children with hearing loss may need additional visual, tactile, or kinesthetic cues in addition to auditory feedback when working on articulation or phonological errors. Depending on the level of their hearing loss and their amplification device, they may not be able to fully rely just on the auditory feedback. So they produce a sound and they still may not be able to hear if it's correct or not. And so the therapist may need to come up with some other ways of helping them to determine if they're producing the sound correctly. The clinician must also be familiar with the child's hearing capabilities with their hearing aids or cochlear implant. And so they need to understand not only the child's hearing loss, but then also with the hearing aids, what is this child perceiving? What should they be perceiving? And it's important that the audiologist be monitoring their hearing and their devices to make sure that they're working appropriately and functioning and providing the correct amount of amplification in order to have access to these speech sounds. And so really, in these cases, the audiologist and the speech-language pathologist need to be, or the educator of the deaf, they all need to be working very closely together, because if the hearing aid's not working and that child isn't able to perceive that sound, then it's going to take more time to try to work on the SLP side of thing, teaching that sound, versus the audiologist making sure that the device is working so that they have the auditory information necessary for that sound, and then the SLP can really be focused on that, and hopefully they'll make progress faster. So it's a team approach. And then it's important also that the clinician be familiar with the impact of co-articulation, so how sounds are being created together or in what order it's going to affect their perception. So it's important to understand that. For language assessment, hearing loss in children can impact development of the form, which is the phonology, the syntax, the morphology, the content, which is the vocabulary and semantics, and the use, which is the pragmatics of language. And so it's important to understand the language characteristics in children with hearing loss as compared to their normal hearing peers. You can do formal language measures, which can assess the language development of a child with hearing loss as compared to their normally developing or normal hearing peers. And table 6.2 on page 228 goes over some of those different tests that are available. You can also use criterion referenced assessment. So this doesn't include normative data, but is more of a checklist, and it can help you track progress. And so either of those can be helpful, or maybe a combination of both a formal language measure, which includes the normative data, and then a criterion referenced assessment that doesn't. And then it can also be beneficial to obtain language samples and narrative assessments. This can help with the initial assessment and also to monitor progress as they're receiving auditory training. So this presentation I wanted to keep pretty short because I know you need to be able to have time to complete the LACE forum, and then also more focused on what we talked about today, or that you've listened to, is the HOPE forum, which was created by Cochlear Corporation, which is one of the companies that has cochlear implants. And they've created a whole section that provides sessions on specific areas of auditory training and rehabilitation for children with hearing loss. And so I've provided the link for that in the HOPE forum, and I'd like you to pick one of those sessions to watch, and then you'll be posting on that in the forum. So be sure that you get that done as well as the LACE forum. So you have 2 forums for this week. Again, if you have any questions or you just need clarification, you can always post in that I Need Clarification forum or contact me and let me know. Have a great week.